It's February 19th, 1994, and at Riverside General Hospital in Southern California, it was Saturday night. The emergency department is exactly what you would expect on a weekend. Everybody is occupied, doctors are rushing between patients, nurses are trying to stay one step ahead of the constant stream of emergencies, and ambulances keep arriving with more patients who need immediate attention. It's controlled chaos, and everyone working the shift is focused on one thing: getting through the night. And at around 8:15 that evening, paramedics wheel in a 31-year-old woman named Gloria Ramirez. Gloria has been battling advanced cervical cancer, and by this point, the disease has spread so aggressively that her body is beginning to shut down. Earlier that day, her boyfriend called 911 because she had become violently ill. She couldn't stop vomiting, she was struggling to breathe, and her heartbeat had become dangerously irregular. By the time she reaches the hospital, she is barely conscious, and anyone looking at her can tell she is in critical condition. For the doctors and nurses, though this isn't an unusual case, emergency rooms see patients arrive in conditions like Gloria's every single day. Nobody in that room is thinking they are about to witness something extraordinary. They are simply doing what they have been trained to do. An IV is started, medications are administered to slow her heart rate, and sedatives including Valium, Versed, and Ativan are given in a hope that her condition can be stabilized. For several minutes, the treatment follows a familiar pattern. Every member of the team knows their role. Everyone moves almost automatically, and despite the seriousness of Gloria's condition, nothing suggests that this night will be remembered any differently from other countless nights. Then suddenly, Gloria stops responding. The medications are not working, so the team decides to defibrillate her. As they are preparing the equipment, one of the nurses notices something odd. Gloria's skin has an unusual oily sheen that catches fluorescent lights in a way that it doesn't look like a sweat. It almost looks like a thin layer of film has been formed across her body. It's strange, but patients with severe medical distress can present with unusual symptoms. So nobody stops what they are doing to investigate. Almost at the same time, another member of the staff notices a smell. At first, it is faintly sweet, almost fruity, but underneath it is another odor that is much harder to ignore. It smells distinctly like garlic. Again, they keep doing their work and nobody interrupts the treatment. When somebody is actively dying, strange smells are far less important than trying to keep the person alive. Before either of them can make sense of it, Susan Kane suddenly collapses onto the emergency room floor. At first, nobody assumes her collapse has anything to do with Gloria. Emergency room staff work exhausting shifts, and people occasionally become dehydrated, lightheaded, or simply push themselves too hard. But before anyone can even help Susan, another member of the staff says they can't breathe. Seconds later, someone else becomes dizzy, and another nurse feels nausea. A respiratory therapist starts complaining of muscle spasms. What initially looked like an isolated incident begins unfolding into something far more alarming. Within only few minutes, the emergency department descends into confusion. Doctors, nurses, respiratory therapists, and technicians start falling ill one after another. By the time hospital administrators understand this is not a coincidence, 23 members of the emergency department have developed unusual symptoms after treating a single patient. Nobody can explain what's happening. There hasn't been a chemical spill, no equipment has malfunctioned, no alarms have sounded, nothing inside the room appears dangerous. Yet healthy medical professionals are becoming patients themselves while standing around Gloria's bed. The hospital immediately declares an internal emergency. Patients who are stable enough to move are evacuated from the emergency department, while administrators try to determine whether something inside the hospital has contaminated the area. Only a small group remains behind to continue treating Gloria, rotating in and out of the room while wearing whatever safety equipment they find. The problem is that nobody knows what they are protecting themselves from. There is no obvious chemical leak, there is no visible cloud in the air, and there isn't any indication of infectious disease spreading through the department. All they know is that more than 20 members of the staff have suddenly become ill. Despite every effort to save her, Gloria Ramirez dies later that night. Her official cause of death is kidney failure caused by complications from advanced cervical cancer, and that conclusion has never really been disputed. The mystery begins with everyone else. One of the most seriously affected staff members is Dr. Julie. Unlike other staff members, she isn't treated and released after a few hours. She spends 2 weeks in ICU, and over the following months, she develops hepatitis and later avascular necrosis in her knees, a condition in which bone tissue begins dying because it has lost its blood supply. The damage becomes very severe that she eventually requires surgery. Julie would later insist that whatever happened in that emergency room was real, because in her view, fear alone couldn't explain the injuries she suffered. Investigators naturally assume that they'll identify the cause very quickly. 23 hospital workers don't suddenly become sick without leaving some evidence behind. The investigative team thoroughly searched the emergency department for dangerous airborne chemicals. But every air sample comes back clean. Toxicology tests are performed on the affected staff. Riverside County conducts its own independent investigation, hoping to find something that first investigators missed. But even they reach exactly the same conclusion. Everyone agrees something extraordinary happened in that emergency room, yet nobody can identify what it was. Eventually, scientists from Lawrence Livermore National Labs are asked to review the case. They propose what becomes the leading scientific explanation. Their theory suggests that Gloria may have been using dimethyl sulfoxide, commonly known as DMSO, as an unapproved treatment for cancer pain. According to the hypothesis, a series of unusual chemical reactions involving oxygen therapy and electrical shocks from the defibrillator transformed that substance into dimethyl sulfate, an extremely toxic compound that could explain why so many members of the medical staff suddenly became ill. It was a compelling theory, but it didn't convince everyone. Several chemists argued that kind of reaction is not possible in that emergency room. In other words, while the explanation sounded scientifically possible, many experts doubted it could actually have happened the way it was proposed. As the theory lost support, investigators were left with another possibility, that the entire incident had been a case of mass psychogenic illness, more commonly known as mass hysteria, where fear spreads through a group of people and produces genuine physical symptoms without any physical cause. Dr. Julie rejected that explanation outright. She argued that panic might explain someone fainting, but it couldn't explain weeks in ICU, documented organ damage, or bone tissue dying months after that incident. More than 30 years later, that disagreement still hasn't been resolved. Gloria's death has an accepted medical explanation, but the illness suffered by the 23 people treating her do not have an explanation. Multiple investigations, toxicology reports, competing scientific theories, and decades of debate have all failed to produce an answer that everyone accepts. Most people leave the story there, treating it as one of the modern medicine's unsolved, strangest mysteries. But what makes this case so fascinating is that almost 4,000 years before Gloria entered that emergency room, another civilization described a pattern that sounds exactly familiar. Forget about Gloria or Riverside General Hospital for few minutes, because almost 4,000 years before that night, people living in ancient Mesopotamia believed there was something that visited places where death was already waiting. Its name was Lamashtu. Now, if you have never heard that name before, that's completely understandable. Outside of historians and archaeologists, most people have not heard that. But if you had lived in Mesopotamia thousands of years ago, chances are you would have known exactly who she was. Because people feared her enough to carve protective amulets write prayers specifically against her, and carry those prayers into the homes of the sick. Every ancient civilizations had monsters, demons, and evil spirits. Whenever people couldn't explain something, it was natural to blame it on the supernatural. Lamastu wasn't feared because she could cause diseases, but she was feared because they believed that she followed it. That's a small difference, but it's an important one. According to the oldest surviving Mesopotamian texts, Lamastu didn't wander through cities looking for healthy people to attack, and she wasn't believed to randomly choose her victims. Instead, she was said to appear wherever someone was already close to death. Imagine a family gathered around a loved one who's become desperately ill. A physician has been called, relatives are standing around the bed hoping for good news. And everyone in that room knows that if something doesn't change soon, they're going to lose someone they love. According to those ancient texts, that was exactly the kind of place where Lamastu would appear. Because the dying person wasn't believed to be her target. The text describes something much stranger. They say the sick person was already slipping away, and Lamastu wasn't interested in changing that. Instead, her attention was focused on the people trying to stop it. The physicians treating the patient, the caregivers leaning over the bed, and the family members when they are refusing to leave their loved one's side when they are ill. What's interesting is that this wasn't just a belief shared by frightened families. The physicians believed that too. When most people think about ancient medicine, they imagine little more than herbs and superstition. But Mesopotamia actually had trained physicians who examined patients, prescribed treatments, and kept written medical records. But still, many of those physicians refused to approach the critically ill patients without first performing the ritual meant to protect themselves from Lamastu. Think about what that means for a second. The people whose entire profession was saving lives believed there was something dangerous about standing too close to the dying patient. Not because they thought the patient was contagious in the modern medical sense, but because they believed another presence was drawn to places where death was already close. Over the centuries, that belief became deeply woven into Mesopotamian culture. Archaeologists have uncovered protective amulets bearing Lamastu's image, along with clay tablets containing prayers and incantations that were specifically intended to drive her away. Whether they were coincidences or genuine religious beliefs is something that historians still debate. And modern historians don't treat Lamastu as evidence that a supernatural being actually existed. What they do find is how the specific pattern remained constant for these many years. Different cities, different generations, and different rulers all preserved essentially the same story. And that's what makes this worth talking about. Now remember back what happened inside Riverside General Hospital that night. Gloria Ramirez was already dying before she arrived. Her illness wasn't a threat to doctors and nurses treating her. Cervical cancer isn't contagious, and yet one by one, the people closest to her bed began to fall. The pattern seemed to spread outward from Gloria's bed until 23 members of the medical staff had developed unexplained symptoms. Same pattern as if Lamastu was present in that emergency room. That is the same sequence described in Mesopotamian texts thousands of years ago. I am not suggesting that Lamastu walked into Riverside Hospital in 1994. There is no scientific evidence for that. Gloria Ramirez was a real person. The illness suffered by 23 hospital staff are documented. But what has never been documented is the connection between these two stories. Maybe those two stories have absolutely nothing to do with each other, but the pattern remains same.